So, a couple things. Let's talk about your stethoscope first. You got some picture. You got your stethoscope out. All right. So, a few things here. I'll teach you about these. One is obviously these are the earpieces. You'll notice they're at an angle, or if they're not, they should be a little bit of an angle. Okay. The easiest way for you to get a good seal in your ear so you can hear really well is for them to be angled kind of forward, so that the earpieces are kind of like pointing towards your nose. That makes sense. You may want to scrub these before you actually put them in your ears. So actually, let's just talk about how to clean them real quick. Anyways, so yeah, every time you use these, you definitely want to clean the earpieces with your alcohol swab. I don't even think anybody's used these. Maybe they have. Okay, and then to clean the tubing is kind of like when we talked about the thermometer the other day. You always start clean and wipe towards the dirty part. So this is the dirty part. This is the part that touches the person. So to take the tubing, I always just pull it all the way down, and then make sure you clean the stethoscope. Definitely hadn't been using it. Okay, that's how you clean it. All right, so a few things. Your earpieces, like I said, you want them pointed kind of towards your nose. So whenever you put them in your ear, go ahead and put them in your ear. You can tell when they kind of get a good seal because your voice gets kind of sinusy. That's how you know. If you can hear a whole lot of outside noise, you'll have a really good seal. Okay. So a couple things about this end of the stethoscope. Okay, you've got two parts at the end of your stethoscope. This larger portion, this is called the diaphragm. Okay, kind of like your diaphragm that helps you breathe. Okay, this back portion is called the bell, smaller one. Now you use the bell sometimes to listen to very specific assessments, but we won't be using it in here. So here's what I want you to do now is take the head of your stethoscope, that's what this is called, and twist it on the tubing. Okay, see how you can twist it? Twist it on this way. Now look at the little hole inside the bell, and you can see when that tubing has caused the head of your stethoscope to be like open and closed. Everybody see that? Everybody see it? Okay, whenever you're using the diaphragm, this larger portion, which is what we're going to use for everything we do in here, you want to make sure that that's closed. Okay, so if you're trying to listen to somebody's heart or their lung sounds or their blood pressure and you're not hearing anything, always check and make sure that that's closed. Because if it's open, you won't hear anything. You'll just hear outside noise. Okay, so, and you can hear it. You'll go ahead and put your earpieces in and twist that. You can hear the difference. Careful, hurt your ears. Drop it. You got it. So, kind of tap on it very lightly with it closed, and then tap on it again with it open. Everybody hear the difference? Okay. You want to make sure that it's closed. You can get a good noise. Now, another thing about these is we don't want to play around with them. Okay, if somebody's got their stethoscope in, don't run and like scream into the head of their stethoscope, okay, or like smash it on the desk or something. That might hurt their eardrums. Okay, they're not very happy. Yeah. So that's a couple things about the stethoscope itself. Any questions about any parts of that? Okay, so let's talk real quick about finding a pulse on someone. Were y'all able to find pulse yesterday? A carotid pulse is usually really easy to find. So usually use your first 2 fingers, or you can use 3 fingers if you need to. It's just kind of like right below your jawbone. And if you'll flatten out your fingers against your skin, it's easier to find. All right, find theirs. Find it? Okay, so that's carotid. Now that one's pretty easy to find. I don't usually check if somebody's carotid pulse unless there's like a reason to. Usually I use radial. Okay, remember the radius, the bone that's always on your thumb side of your forearm. Okay, so it's this bone here. Your radial artery runs kind of right along the side. So if you'll go down from your thumb into that little kind of groove between your tendons, that is the easiest way to find it. Go right in the center. You might find an artery in there, but it's easy to go just for that groove right in between like your radius, the bone, and then those tendons. Now if you use your thumb has its own pulse. So on yourself it's not really going to matter. But on somebody else you don't want to use your thumb because you might actually pick up your own pulse instead of theirs. Everybody find it? So now just keep in mind whenever you're checking someone else's pulse, that it's, you gotta look at, it's going to be opposite, like you're looking at it, it's going to be opposite. So always use your thumb as your landmark and go down from their thumb. Okay, so let's all practice checking our own pulse. Now, a couple hints about watching the clock, especially one like this that has seconds on it. So how long are we going to check for?
30.
30. Let's do 30. I don't want to do 15 because I know that that's what you did at the Pro Museum the other day, but I don't want to do 15 because, one, it's hard to tell if they have something irregular going on. 15 seconds isn't really quite long enough to figure that out. And so, plus there's a little bit less math involved. So we're going to do 30 seconds. So the easiest way to know 30 seconds, so you're not counting seconds and trying to count your pulse, is that on the clock, it's just the opposite. So if I start at the 11, I'm going to count until it gets to the 5. It's just the complete opposite end of the, of the hand, the second hand on the clock. I know y'all know that from like elementary, but it's a little refresher. Okay, same. So all you do is you count until that time period is over, and then you multiply it by 2. So y'all count yours. Kind of hot today. What y'all get? 44? Are you sure you want that? Did you multiply it by 2? Oh, no. Okay.
I'm at 60.
Do what?
60.
60? Okay. Mine was 88, so mine was 44. Anybody else? What? 72. Good. Now I'm asking you. What'd you get? Okay. So, yeah, that's it. That is some math. You do need to start doing it in your head. Okay. But it's really easy math to do in your head. Think about it. If you get 36, you can do 6 times 2, which is 12, and 30 times 2, which is 60. And you just add them up. 60 and 12, 72. Okay. So that's the that's that. Okay, so that's heart rate. Anybody have trouble? We'll practice on each other. Sometimes it's a little harder to find on other people than it is on yourself. I will recommend again that you keep your fingers kind of flat. That helps to find it. And because the end of your fingertips usually pretty calloused, and so they don't have as much feeling as like the pads of your fingers have. So that's another thing. What else? Oh, sometimes if you're having trouble, you can use all 3 fingers, and that kind of gives you a big, bigger space to find the pulse too. So the things that you're supposed to, characteristics of the pulse that you're supposed to look at. Rate, we just talked about rate and how you find that. What else? What are the other characteristics? Rhythm. Okay, so is it regular? Is it beating on a regular pace, or is it like, does it have an abnormal rhythm? Is it beating really fast and then really slow, or skips a beat? What else? What are some other things you're going to look for? Do it. Volume. Remember, that's how strong it's beating. So how do you document volume?
1, 2, 3.
Yeah. +1, +2, or +3. Okay, so what is y'all's? What do y'all think? It's probably a +2. Usually it's going to be a +3 if you're like running or you've been exercising. It's like, you can like feel it beating out of your neck kind of thing, or see it. And then if it's a +1, then you may have something going on. You're not getting good circulation or something. Rhythm, rate, volume, and bilateral presence. What's the other one? So if I'm going to check bilateral presence, I didn't have arms up there, but I just check both wrists. Okay, so that's all I did. I'm going to check bilateral presence. I just grab both of their wrists and check them for a few seconds at the same time. Make sure they're beating at the same time. You don't have to do a whole 30-minute pulse. 30-second pulse again on both sides. You just check it to make sure that they're equal and present. So when you answer, okay, good deal. Respirate. Oh, let's do apical too before we get going. So what you'll hear, the difference in this is one with a pulse that you check like on your wrist. Hey, and you're just going to feel that one beat. But whenever you listen, you're going to hear two sounds. And those two sounds just create one beat. The reason that you hear two sounds is that, remember, you've got two sets of valves. You've got the AV valves, remember the atrioventricular valves, like the tricuspid and the mitral. And then you got your semilunar valves, the ones that go to the arteries, the pulmonary and the aortic valves. Well, those open and close at different times, and that's what you hear. Okay. So y'all listen. So hear yours real quick. Usually kind of right in the middle to the left. Make sure it's turned around. Got it? Sweatshirt may be too thick. You may need to twist your earpieces around. They'll usually twist if you need to twist your earpieces around so that they're pointing the same direction. I'm gonna let y'all listen to some heart sounds on here. Turn this on.
You need it open to listen to it, right?
No, it's gotta be closed to hear. Yeah, it's gotta be closed to be able to hear. Okay. All right, so some common heart sounds. I'm gonna play them on here for you guys. So here's your normal kind of heart sounds. I'm gonna play. Okay, that's probably like what you guys heard. Here says this is a normal heart sound recorded from a 1-year-old boy. So we know 1-year-old boy, what should their heart rate be? Yeah, it should be much faster, like well over 100. It's much faster. Okay, let's see. Okay, here's an irregular heart rate. So that sometimes you can have an irregular heart rate, like your heart beats faster on inspiration because of kind of that pressure, like you're breathing in, you know, the pressure that it puts on the heart. So that can be normal fine. But you could hear it kind of went fast and then went slower. It says highly irregular heart rates can be a sign of disease. So this was somebody with atrial fibrillation. And the word fibrillation, I think it may be a payday term this week. Maybe it was last week. Anyways. Fibrillation means instead of a heart that, like normally your heart will pump, I mean it pumps regularly. I mean it pumps out, opens up, pumps, open, pump, open, pump, open. With fibrillation, instead of your muscles actually like contracting and squeezing in the heart, they actually just kind of like quiver in place like this. That's atrial fibrillation. Now this only happens in the atria. I think we talked about this when we did the heart stuff anyways, and so blood doesn't get pumped out efficiently, so it can stay in there, develop blood clots, and some other issues. But here is atrial fibrillation. See how there's some extra sounds in there, and then it'll skip a beat. That doesn't have that regular pace to it. Okay, that's irregular. Heart murmurs means that they have like a third sound, and usually a heart murmur is a result of a valve that does not closing like it needs to. Hear that whooshing noise? Instead of a steady beat, it's like a whooshing kind of. You hear it like whoosh, whoosh. This is not very loud, but so it has like a whooshing noise. It's not just like a steady beat, and it's because of the extra, just the way that blood is not moving like it needs to. Following sounds were recorded from a patient with advanced aortic stenosis. The first sound was recorded at the aortic area. And that whooshing. Whoosh. It still has the beat, you know, that kind of steady beat, but it's got that extra noise in there. A low-pitched murmur. Everybody hear the difference in those versus the first one that we play that first one again. You know, it's got a good sound to it. It's another murmur. Anyways, I just let's see. Aortic stenosis. That third noise in there sounds like a purr or something. look, this person has a prosthetic valve, and they've had a valve replaced. It's crazy that doctors can listen. I mean, to me, they all sound different and not normal, but I would never be able to like diagnose somebody just listening to it. You know, they don't sound different enough to me, but that's what they do. Okay, here is one. It says this is a PDA. Do you remember talking about this? A patent ductus arteriosus. It's one of those. We talked about babies' hearts and how sometimes there's a hole that's still there. You know, even after they're born. It still has that whooshing noise because blood is moving where it's not necessarily supposed to be moving. Here's a VSD, so a ventricular septal defect. So this is where they have the hole between the ventricles. Here's a mitral valve prolapse. There's lots of people. I think Coach Dowers used to. I think he had his valve replaced, but still hear that. Anyway, pretty crazy. So, anyway, I just wanted you guys to hear some different sounds that you might hear. Okay, let's talk about respirations for a minute. So a few things to look at respirations in particular. One is the rate, and you're going to do the same thing. You're going to count their respirations for 30 seconds and multiply it by 2. Okay, so, and it's easiest, like I said, if you do this when they don't know that you're counting their respirations. Now, it's not really going to work so well in here while we practice on each other because we know what everybody's looking for. But I always I'll take their wrist, I'll check their pulse for 30 seconds, and kind of make a note in my head of what their pulse is, and then I always keep my hand on there while I'm checking their respirations. Or I'll check their pulse with one hand and put one hand on their shoulder. I can tell when their shoulder goes up and down. That's the best way to tell, just to get the rate of respirations, is just by watching, okay, observation. So what are some other things you're going to look for as far as respiration goes? What are their characteristics?
Irregular breathing, like kind of like skip a breath.
Okay, so regular, irregular. Are they breathing kind of a paced type of breathing? Good. Usually you're going to know. It's going to be pretty obvious if they're not. What else? What about volume? Are they breathing shallow? Are they breathing really deeply? You know, and normally people are just going to breathe and it's not going to be that big of a deal, but you can tell. If somebody's just breathing shallow, it's usually because they're just sitting or they're lying down or something else is going on, and they're just like, their chest doesn't necessarily move very much, versus breathing deep when they're like, you know, trying to pull in air. So those are, those are the other things to look for there. And then are they just having to work really hard to breathe? Sometimes people will do what's called tripoding, and if they're trying to breathe, they'll like lean over and put their hands on their knees to try to like open up their lungs more to catch their breath. People will do that kind of automatically and trying to catch their breath. Or they'll do like pursed lip breathing where they're probably may have been around somebody like that. They're really short of breath before. So those are some other things to look for. The retractions is one I always look for, especially for kids with asthma. That was something we always noted. There was like 4 places where they can get retractions. And you'll literally, when they breathe in, they're like right up here, especially right above their collarbone, it'll just like suck in because they're just working so hard to breathe. So those are some other things to look for. You guys can get out your stethoscope, listen and see what your lungs sound like. You can listen in there. I'll hyperventilate doing this. same thing. You'll want it closed again. Again, you don't have to, when you're just getting the respiratory rate, you don't have to listen with the stethoscope. The easiest way to listen to someone else's lung sounds is usually on their back. So normally if you're like really assessing someone's lung sounds, you're trying to see if they have something abnormal going on, not just get their respiratory rate. You'll listen all the way down their back. I mean, you know, you think about your lungs kind of go to basically the bottom of your ribs. So that's where you would want to listen to. Let me play some lung sounds for you guys too.
None of yours work. Did yours not work?
Okay, so here's some lung sounds that you might hear. Okay, these are sounds you'll normally hear over the bronchi. Did I already play these for you last week? Okay. This is vesicular sounds are like over the alveoli, so kind of like farther down in the lungs. Okay, crackles are usually the term we use to describe somebody if they have fluid in their lungs. So that's what you'll usually hear. Well, they kind of sound like a popping noise. They always said in nursing school, they used to say it sounds like whenever you take your hair and kind of like crunch it in your ear. And so one of the things that they usually, like it says, they're caused by, it's kind of that makes that popping noise because of that fluid that's in there. You know, that fluid kind of moving out of the way. Coarse crackles, same kind of idea, bubbly sound. Wheezes are usually heard on expiration, so when people breathe out. There's some pretty, that sounds crazy. Those are some pretty coarse wheezes, but they can get so high pitched that you can barely even hear. I mean, they can be really high pitched. If the blockage, if the airway is really, really constricted to where it's just tiny, those wheezes can be really high pitched. I mean, even sound just like you can almost not hear. Like I've had a kid come into the emergency room before and literally could not hear anything except a little bitty like, and that's it. That's because all the air they were moving. So they can get really high pitched too. Squawks, it says these are inspiratory wheezes. They might have pneumonia. So those are some other sounds you can hear. Bronchi is typical with like COPD, somebody who's had emphysema or chronic bronchitis. It's hard to hear. A pleural rub. This is somebody who has pleurisy, so their pleuritis. Anyways, where the lining, you know, that double layer lining around their lungs loses the fluid, and so it rubs against each other. And then stridor is actually a wheezing noise, but it's usually up in the upper airway. So they've swallowed something and it's gotten hung, or choked on something and it's gotten hung. There's something like here. Or if they have croup. We talked about croup, didn't we? With the, I'll show you picture. It's usually like I said, kind of this main part. Let me show you a picture of caused by a constriction of the trachea. And so look, they have this, they call it the steepling side. You can see here. Okay, this is the trachea where it's dark. See how it narrows right here? That's where it's constricted. Okay, that's the area. It's narrow like that. It's a very, it's a viral illness usually, but it can be, I mean, you know, it's bad news. And it's something you want to play around with. This one's hard. Oh yeah, there it is. See how it narrows right here? Here's another one that narrows right here.
What causes it to be constricted?
It's a viral. It's just a viral sickness that you get in the trachea. They usually, in the emergency room, they'll give them like one dose of steroids to decrease inflammation, and that's it. Since it's viral, you can't really give antibiotics or anything like that for it. So, anyways. But I think that's it. We've still got about 7 or 8 minutes. I'd like for you guys to find did y'all pick up one of these papers? If you didn't, where you can list out, do your log or whatever. Find somebody to work with today. Check their pulse, check their respirations. You don't really need the stethoscope for today. I'm just going to check it. And so I want everybody to check at least one person before you go today.